Today I'm going to address a number of issues that have been raised on our social media sites about the COVID-19 vaccine. These are very, very important issues and I'm very glad to everyone who's brought them forward. Please keep raising the issues and I'll address them. So the first issue is there are some queries from people about the safety of the vaccine because people think it was so rapidly developed and it didn't go through the normal testing process. That's not the case. The reason the vaccine has happened so quickly, and it's fantastic it's happened so quickly, is that the researchers knew from day one that they would have the money they needed to go through the whole process. So instead of just doing part of the testing process and waiting for more money when that was successful, they just kept going. So they were able to concertina years and years of work into a year. All of the work that they would normally do, they did, and it was successful, and as a result we've got a whole range of fantastic vaccines. The second issue people have raised is concerns about the severity of side effects of the vaccines. This vaccine does not cause any more severe side effects than a whole range of other vaccines that we're very used to. For instance, the flu vaccine. And indeed, in many cases, the vaccine side effects are less. So the only side effect that we have really seen to date is for people who have severe anaphylactic reactions to vaccines or to food. So they need to speak to their doctor or their healthcare provider before they get vaccinated. But for the vast majority of people, this is a very, very safe vaccine. The next issue that's been raised is that COVID-19 vaccines will alter my DNA. No, there is no risk that the vaccine will alter your DNA, none. Then the next issue raised is that COVID-19 vaccines can cause infertility or miscarriage. No. So that's been looked at. We are recommending at this stage, till we get a bit more evidence of the vaccine having been given to women planning pregnancy or pregnant women, we suggest that you at the moment just talk to your healthcare provider if you're pregnant or planning on getting pregnant before having the vaccine. But a lot of women who have subsequently then got pregnant have been vaccinated in other countries and there's been no increased risks at all. So we think it's perfectly safe, but at this stage, till the TGA looks at all of that evidence and gives that advice, we're recommending that women who are pregnant or planning to get pregnant to speak to their healthcare provider before having the vaccine. There's no reason for them not to have the vaccine, but they just should discuss it with the person who's going to give it to them. The next issue raised is that one person has raised that there's no point getting one vaccine versus another, that the Pfizer vaccine is more effective than the AstraZeneca. That's not the case. They are both very, very effective vaccines, and personally I intend to have the one that I get offered first. It's most important to just have the first vaccine you are offered because there is no difference really between the two vaccines. As I said, will probably end up with the AstraZeneca because that's what the majority of Queenslanders will be offered because that's the larger number that we have, but I don't mind which one I get given. They're both very, very good vaccines. The next issue that has been raised is that people don't know if these vaccines are safe in the long term, as no long-term testing has been done. There has been longer-term testing done in that the vaccines have been trialled for nearly the last year. So we've seen no evidence of any long-term effects and we'll continue to monitor that as we go forward. But there's no suggestion that there's going to be any long-term problems with either of the vaccines that have been approved to date in Australia. The next issue raised is that people are using the no jab, no pay policy to make people get the vaccine. It shouldn't be mandatory if I'm not comfortable. At this stage, there is absolutely no suggestion that this vaccine will be made mandatory. The Prime Minister has stated that, all leaders have stated that. But we do aim to give as much information as possible so that people will choose to get vaccinated. And that's my role here today, to give you the information you need so that you can understand that these vaccines are very safe, very effective, and anyone who's able to be vaccinated should get vaccinated to protect themselves, because the best way of protecting yourself is to have the vaccine, because we know the vaccine reduces the severity of disease, significantly reduces your risk of being hospitalised and of dying. So it's really important that as many people as possible get the vaccine, but it is not mandatory. Then the next question is a very, very sensible one. What is the point of having the vaccine if it doesn't stop me from getting the virus? The point of having the vaccine is it mightn't necessarily stop you getting infected, but it will stop you getting severe disease and stop you dying. So we know that not all vaccines stop people getting infected, and that's true of a whole range of vaccines. But all vaccines will stop you dying. And that's why you need to have this vaccine, to stop you yourself dying from the disease, although you might still get it and pass it on to other people, which is why that as many people as possible need to get vaccinated. Then the last issue that I'm going to address for today is that there have been stories that the vaccine could harm people due to ingredients within their vaccine that are not good or could result in other issues. That's not the case. These vaccines have got very few additives, and the additives that are in there are ones that are in a whole host of vaccines, and we understand them. The only people that should be at all concerned about the vaccine and the other additional ingredients in the vaccine are people who have had anaphylactic reactions to other vaccines. They need to speak to their doctor, and their doctor will know, and it's on the website. Anyone can go to TGA and look at the website and see all of the ingredients that make up the vaccine. The biggest ingredient in actual fact is water, because you need to have a liquid to be able to inject the vaccine. But there are some other ingredients, and if people are concerned about them, they can go on to the TGA website and see what those ingredients are, and they can talk to their doctor about it, because their doctor will know if they've had anaphylactic reactions to other vaccines, whether there's any issue there. For the vast, vast majority of people, those additives are not any risk at all. So thank you for all of those very important issues people have raised. Please keep raising them and we'll continue to address them. Thank you.